Welcome to Reporter's Notebook, where we talk to the Washington Examiner's top journalists about the stories breaking on their beats. I'm Jim Antle. I'm joined today by Homeland Security reporter Anna Giaritelli. Anna, you've been covering the border and the situation at the southwestern border, and there's been a lot of talk lately about Title 42. You've written a piece explaining all of this. So we'll start with the most basic question. What is Title 42?
Thanks, Jim. Title 42 is part of a health law that was passed in 1944. And basically, it was as part of the law that was a contingency for if there's ever a communicable disease that gets out and we need to close the borders to stop the admission of people and goods, we can do that. And it's at the recommendation of the Centers for Disease Control and Prevention, so the CDC. And they're the ones who make the call on whether we get to put that into effect. And in that case, 2 years ago at the start of the pandemic, the CDC did in fact say, yeah, we're enacting Title 42.
Mm-hmm. So that's a point that the White House often makes, is that Title 42 is a public health measure, not necessarily an immigration policy, but it clearly has a pretty big effect on who can come into the United States.
Yeah, and President Biden, when he was a candidate, he vowed to end Title 42 when he took office. It's now 15 months later, and he hasn't ended it yet. And so, yeah, that is the debate. Is it a public health policy or is it an immigration policy? Actually, depending on what side of the immigration issue you fall on, both sides say it's an immigration issue because it's how it's being used. And what I mean by that is, if you're a refugee seeking asylum at the southern border, and you come up to a port of entry where you or I would drive our cars across from Mexico, the officers there, the federal officers, are going to say, sorry, you can't seek asylum right now because Title 42 is in effect. So a lot of times what people do is instead go around the ports and then illegally enter the country. Once they're in custody, then they'll start the asylum process that way.
Mm-hmm. And so obviously the Trump administration had a more restrictive view of asylum and refugee policy and immigration policy. So they were pretty willing to use this power during COVID-19. Biden administration hasn't lifted it yet, but they have a much different point of view on how these matters should be handled.
Yeah, and they're getting a lot of pushback. I mean, the ACLU sued Trump and has kind of re-upped it against the Biden administration, trying to get this to end. What President Biden did when he took office last January was say, hey, we're not going to, under Title 42, if you do cross, you're supposed to get immediately turned away, sent back to Mexico or your home country. Right. President Biden said, we're not going to do that with children who show up without parents or guardians. Mm-hmm. And so that's when we started to see the unaccompanied minor crisis really. It hit the highest level it's ever hit in the Border Patrol's 98 years. More than 100,000 children came across alone in 2021. We also started seeing Mexico say, hey, we're not going to keep taking back families. The US is going to have to take some of these people. So because we're seeing migration from countries we've never seen at these levels before, like Venezuela, Brazil, Nicaragua, and Cuba, the US doesn't have the resources to necessarily fly these people back to their countries over and over again. Mm-hmm. And so people are being released into the United States.
Mm-hmm. So there's pushback also from the other side, where you even have a lot of border state Democrats and Democrats facing tough re-election races this November who don't want to see Title 42 ended because they're concerned that there's going to be another surge at the border.
Yeah, and we're already seeing that surge. I always say to people, over the past decade, we've seen about 30 to 50,000 people encountered attempting to enter the US without permission at the southern border, right? That's in a month. Right now, or since Biden's been in office, except for 1 month, we've seen 150,000 to 225,000 per month, right? Mm-hmm. And I think the concern is we're already seeing the impacts of Title 42 ending. The Biden administration is quietly transitioning policies behind the scenes. A little too complicated to get into, but starting to, so you're already seeing extremely high numbers right now. And like you said, 9 Senate Democrats have already come out and said, we don't support ending this, which is, pretty surprising. For a long time, Congressman Henry Cuellar who faces a tough reelection against someone that AOC has endorsed. He's been the only outspoken person. And so now we're really seeing Democrats coalesce around, maybe we can make concessions to end Title 42, or maybe it needs to be done differently.
What's the timeline look like for the administration's decision?
So the administration announced in early April, I should say the CDC announced they would not continue Title 42. They've been renewing it every 2 months. And so it is slated to expire on May 23rd. At this point, the Biden administration hasn't budged at all, despite the Democrats coming forward and saying, this is going to hurt our chances if we do this come November.
The White House has also kind of put some of the onus on Congress, saying, you need to pass legislation to deal with this. Yeah,
I don't totally get that, frankly. It's the CDC is acting based on a law. So I don't think a new law needs to be put in place, but it's certainly, everything goes back to Congress, right? And when Congress doesn't act, the courts do. So that is something that we could see with different lawsuits that are supporting Title 42 and then opposing Title 42. We'll see.
It's going to be a busy month at the border. Thank you, Anna.
Thanks, Jim.
You can read Anna and the rest of our policy team's coverage at WashingtonExaminer.com.